The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Nadea's eye muscles are repaired. Christen is injured in a field hockey game. Erin's fused feet are reconstructed. And Armand needs major surgery to close the hole in his heart.
Like, I was not expecting to have, to be told that our baby needs open heart surgery.
Five-month-old Armand was born with a large hole between the two pumping chambers of his heart.
Where are the kids over there? Look at the kids.
His heart is unable to deliver enough blood flow to his body, and if untreated, Armand will die of heart failure.
He's really aware of what goes on.
Yeah.
You can just keep playing with that.
Today, he undergoes final testing to ensure he is healthy enough to withstand major surgery to close the hole.
He was term, and everything went pretty well, actually. We thought it was pretty normal. And attending pediatrician mentioned that he had a heart murmur, and murmurs actually run in my family, so it was nothing new. So it never entered our mind that he'd have a problem. It wasn't until probably a couple of weeks ago when I went to a pediatrician for a different problem for him. He has thrush, which is now gone. But the pediatrician with, I guess, 22 years experience noticed that his breathing is labored, and I just thought it was part of his personality, this grunting sound. And from there, she sent me to sick kids. Like, she told me not even bother going home, just go right to cardiology. And then within a couple of days, we found out that he had a hole between his two ventricles. I was not expecting to be told that our baby needs open heart surgery. That just floored me. No, he's in good spirits, good condition. You wouldn't think that anything was actually wrong with him. He just has really skinny legs. He's got skinny legs.
Well, his heart is beating twice as fast. Now we found out, his heart isn't supposed to beat twice as fast as a normal heart.
Yeah. So it'll be good to get him sort of fixed and on his way back to health. Where are you going? Okay, let's do it.
You ready for this? Huh? Here we go.
14-year-old high school student Erin was born with Apert syndrome, a rare genetic condition that has resulted in fused bones in his skull, hands, and feet. Erin has already endured 21 reconstructive operations to build fingers and toes and reshape his cranium. Over the last few months, walking has become increasingly difficult for Erin.
So what grade are you in, Erin?
10.
10. So you passed the minor niner, right?
Yes.
So today, Erin faces his 22nd surgery. Doctors will cut through fused bones in Erin's feet and reposition them in the hope he can walk pain-free.
Most of the time, I think he doesn't want to be seen as different. He wants to be seen as just one of the kids and tries to do everything that everyone else can do, and makes a good solid effort at it. And if he can't do it, then he'll say so after, but he always gives it a try first. So we do what we can do, right?
Yes.
We take for granted even something simple as the bottom of our feet, and we come home after a hard day's work and our feet are killing us, and what he's got to go through every day when he gets out of bed.
Yeah.
So
I don't know how he does it. I'd be taking about 4 steps and I'd be sitting down.
Yeah.
You just
So
don't.
it's an exciting day for all of us to see what the end result's going to be. And we're patient, so we can wait those 6 weeks to see, and hope that this is the last one on his feet.
Despite Erin's extensive experience, facing his 22nd surgery is still nerve-wracking. He meets the anesthetist who is responsible for putting him to sleep and keeping him alive during his surgery.
One dad.
One dad, two dad. How do you do? Hi. Hi. How do you do? How are you, sweet pea? Good. How are you feeling today?
I'm tired.
A little bit tired?
Yes.
All right. Can you open your mouth big for me? Big as you can. Big, 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 big. Stick out your tongue.
That's the only time you get to stick your tongue out at somebody.
Can you look way up at the sky? I know. And now the kids always say, there's no sky up there.
Yeah.
Just come a little bit farther away and look as far as you can way up. Good job. And you can look down again. Look right to the ground. Perfect. And just go normal. That's good. I'm just going to feel your chin. Great. Now I read here that you want to go to sleep with a little intravenous.
Yes.
Yeah. Do you want no mask at all, or do you want a little bit of giggle gas?
No mask at all.
No mask at all. Okay, so let me just have a quick peek at your hands here. Oh, that shouldn't be too much of a problem. Do you want to have any questions?
No, I think we're okay.
All right.
We've gone through this so many times now.
Good. All right. So
Right?
I'm just going to go get things ready, and we'll come down in just a few minutes. And
Okay.
All righty? Okay, good job.
Great.
Erin must endure a few more minutes of anxious waiting before his surgery gets underway.
Never wake a sleeping baby. How do you do?
I'm Dimitri. This is Larnie.
Hey, how are you?
Armand's parents meet the cardiovascular surgeon who will close the hole in his heart.
Okay, so you've been through the mill a little bit, and people have explained a lot to you about what it is we're planning on doing. Did you have any questions or things you wanted to ask about?
They told us if we hadn't caught it, he could have got into heart failure, and that really freaks me out.
Right.
So after this, like, what are the possibilities of something freakish like that happening?
Well, why don't we break it down into the issues that are involved around the time of operation and then the long-term issues, because those are two separate things. The issues around the time of operation is we need to close the hole between the lower chambers of his heart. So in the operation, what we'll do is we'll put a little patch in there and close the hole between the lower chambers of the heart. The electrical wiring system in the heart runs right along the edge of that hole. If it's injured permanently, then he would need a permanent pacemaker for the rest of his life. Anybody who goes on the heart-lung machine has a possibility of dying. There's also risk of brain injury or stroke. So, other things can come up, but those are pretty much the most relevant problems that can come up here. I would tell you during the operation, when you're out in the waiting room, don't watch the clock. No news is good news. As long as you don't hear anything, that means everything's okay. If there's any serious problem, I'll send someone out to talk to you.
Armand's open heart surgery is just 1 week away. "14-year-old Christen has been brought to the ER after she was hit in the head by a field hockey ball.
Well, we're supposed to wear mouth guards, but I forgot mine this morning, so I wasn't wearing it. And my coach said I was really lucky, because if the ball had been a couple inches lower, I would have lost all my teeth, which wouldn't have been good.
That's a lesson, isn't it?
I asked the nurse, and she said I could have a cracked skull, which is really scary, because I don't want my head to, fall apart. But I really hope that doesn't happen.
Any head injury has the potential to be serious. Christen is given a standard neurological examination to test for brain injury.
You know where you are right now?
Yeah, at the hospital.
At the hospital? Which one?
Sick kids.
Sick kids. In what city?
In what city? Toronto.
Okay. And your name is?
Kristen.
Okay. Your mom's name?
Muriel.
Okay. And your dad's name?
Michael.
And what's today's date?
October 15th.
Cheating. You're cheating. And what day of the week is it?
Friday.
Symptoms of brain injury can take hours to appear.
And there is some blood in here.
Christen must remain under observation for 4 hours. If her headache becomes worse, she may need a CT scan to check for bleeding.
Hugs and kisses.
Okay, give your mom a kiss. Come on.
No.
All right,
I'm
give your mom a
sorry.
hug then.
The surgical team is ready for Erin.
Give your dad a hug too. Come on. You'll do good.
Give your other dad a hug.
It's time for his 22nd operation to begin.
Seconds.
Good job. Nice and slow.
How fast is it going to go by?
You're going to be asleep in probably less than a minute. Have a nice sleep, okay? Everything's going to go very well.
And how much time is it going to be sleeping?
It's going to feel like a couple of minutes. There you go, boy. Have a nice sleep.
Now that Erin's asleep, his surgeon takes a last look at x-rays of the fused bones in his feet.
You can see on the x-ray, there's the two metatarsals, and when there should normally be a space like there is between the other ones, you can see how he has this fusion between the two of them, and that's not a normal connection between those two bones. So that's what we're going to start by taking that apart, and then we're going to cut some of these metatarsals down here so that they go into a better position for his weight bearing. Can we have a marking pen, please? So let's start with the left side first. So you're going to set up both saws, and yeah, that'd be great, thanks. I might come just in on the lateral side of that tendon, and we'll pull it immediately.
I think there's another tendon here.
Yes, that's what she's going to be careful of.
Yeah.
Okay, you want to get the saw? I think we'll use the micro-oscillating first.
Erin's surgeons must meticulously saw through the fused bones to avoid damage to nerves and tendons.
Perfect.
A slip here could leave Erin with even more difficulty walking than he already has. Erin's family waits for news from the operating room. His surgeon has completed the first phase, cutting the fused bones, and now casts Erin's feet to reposition the bones.
That's fine. So I'm molding this cast so that it pushes the bones back into the correct position, and putting his foot kind of flat to the ground. As you see now how all the toes are lined up. Okay, I got this one.
Once both casts have been molded, Erin's surgery will be complete.
Hi there. How you doing?
Good. All right, how are you?
Oh, great.
Good.
So well done. Everything went fine.
Yeah.
Pretty much exactly as planned. How much he feels walking is very individual. So some guys will get up and they'll be sore, but they'll hobble around right away. Others, it takes a week maybe. I'll see you guys tomorrow, and we'll see how he's feeling then. And by then we should have an idea when he's gonna be able to go home.
Good.
Okay?
Good.
Good. So we'll see you later then.
All right.
Okay,
Thanks.
bye-bye.
Thank you very much. Good.
Erin is now awake, and his parents make the familiar trek to the recovery room.
Hey, buddy. How are you?
How are you making out, buddy?
How do your feet feel now? Still sore?
But he can move his toes, he can feel whenever I'm touching him, and the toes are warm and well.
Yeah.
Oh, that's good.
Yeah.
I love you, buddy. Glad to see you're okay.
It has been over 5 hours since Christen was hit by the field hockey ball. She is re-examined for symptoms.
Good morning, everybody.
Good morning.
How are you? Hi, Christen.
Hi.
My name's Dr. Michael Janakis, and we didn't forget about you. We were letting a little bit of time go by because we needed to examine you again and see how you felt and how your symptoms were.
At first, when it happened, I could see and everything, but I was seeing two outlines of some things, and I was kind of dizzy. That's gone now. I just have a headache.
So we're over the 4-hour time mark, and you're telling me that you feel better? The dizziness is gone?
Yeah, well, they did give me some Tylenol to help get rid of my headache.
The good news is you're sitting up chatting with us. You remember everything that happened. You didn't lose consciousness at all. You haven't been vomiting, and if anything, your symptoms are disappearing. Does it hurt a lot?
Yeah, it hurts a lot more if you touch it.
So you're warning me, are you, not to touch it?
Yeah.
Unfortunately, that's part of what we have to do. When you get hit by something that moves, we want to make sure that it hasn't knocked the bone in at all, which would be a depressed skull fracture, which I doubt you'd have. There's a few things I'm going to warn you against that I want you to be careful, and that's mainly returning to sports. You're the boss. Mom's not going to know how you feel. Your coach isn't going to know how you feel. If you don't feel well, you need to tell them, and you need to rest yourself.
Okay.
Christen also figure skates sort of 5 times a week.
Sometimes it's jumping, it's impact, it's movement, it can be spinning. I really can't predict what sort of activity will bring that out, but any physical activity could do it. Take it day by day and see how you feel.
Do I have to go back to school?
I leave those questions for moms.
Put it this way, if you don't, you're not going out later.
From a medical perspective, you got a big smile on your face, you're feeling pretty good. If you're up to it, I'm happy for you to go back to school.
Okay. Politician.
Fair enough?
Right, that's right.
It is not yet dawn, but Armand and his parents have been up for hours. It is the morning of the open heart surgery that could save his life.
Look at you. You're all set and ready to go.
Armand is the first case of the day. It's time for his parents to say goodbye.
Okay. Wanted to give you a kiss goodbye too.
Keep there for now, because we're probably going to do Armand and everything on the right hand.
Now that Armand is anesthetized, surgery to repair the hole in his heart can begin.
Yeah, we're gonna use it.
There's no TA actually being recorded here.
Yeah, nice. Try to let you do it. Okay. Okay to start?
Tally, yes.
The team's first job is to open up Armand's chest and saw through his sternum. It takes the highly skilled hand of a cardiovascular surgeon to expose Armand's tiny heart without creating any damage. It's been 3 hours since Armand was taken into the operating room. Doctors are ready to close the hole in Armand's heart.
There's our VSD. Right where it ought to be. There's our aortic valve. Fludaraldehyde treated pericardial patch, please.
Tissue from the covering of Armand's own heart will be used as a patch.
Hey, can I see that patch, please? Can I give it this back? 5/0 small needle.
Armand's surgeon now begins to painstakingly sew in the patch of tissue to close the hole between the pumping chambers.
Tiny bit into the valve itself. Yeah, now I'm just going to trim this patch a little bit. Scissor, please.
Any pain?
No.
No? Well, that's a start.
It's been 24 hours since the fused bones in Erin's feet were separated.
Okay, first I want you to shift your bum up in the chair.
Before he can go home, he must demonstrate to his physiotherapist that he is able to withstand the pain of walking in his casts.
Whoa! This is a superstar. Okay, slowly. Stand all the way straight. That's good. Excellent. How does it feel?
Good.
Pain level?
1.
It's doing amazing. Better than I expected. Wow.
Remarkably, Erin is able to tolerate the pain and will be discharged later today. He will return in 6 weeks for a checkup and to have his casts removed.
Way to go, Erin. Amazing!
8-year-old Nadea has come to the hospital to see her ophthalmologist.
That's our weapons there. She's been healthy.
She's been healthy. She's been great.
Nadea's eyes drift outward when she is tired, and she is preparing for surgery to straighten them.
Nadea has a turning out of the eye called exotropia, and we're going to be able to show that her left eye is diverging outward. When I make her look with that eye, the right eye diverges outward. The surgery next month is going to be geared to try and slacken the outer muscles which are moving her eyes to try and make them straighter for her. We want to overcompensate a little bit to take into account the probability, which is the highest, that it will start to drift back out again. So our aim with the surgery is not necessarily to make her straight, but to put her in just a few degrees inward. Now, we're not going to make her a cross-eyed kid in terms of an obvious look. That's not the intention. The intention is to put it in just a few degrees off straight, because the drift back is between 3 and 5 degrees. And we want to aim to put her in 3 to 5 degrees, anticipating that on the average she'll drift back about 3 to 5 degrees. And so the initial few days she may have a bit of double vision just because of the fact that she's being transferred from a turned out position, which her brain has been used to all this time, to a turned in position, which is opposite to what she's been used to. So it's not uncommon for a child to have, especially at her age, to have a little bit of double vision at the beginning. And I want you to look at the E at the end of the room, all right?
Nadea's ophthalmologist uses prisms to gauge how much her eyes turn out and how much of an adjustment he'll need to make to straighten them.
Okay, and that's it. So do you understand everything that we talked to you about?
Okay. I'm scared.
Are you? Well, you know what? It's not unusual to be scared, but you know what? There's a lot of very nice people up there that are going to be really nice to you. And they're going to explain everything to you when you come in for your surgery. So, you feel a little better about going through it now? Yeah. Okay.
Thank you.
Nice to see you. So, you're terrific.
Thank
nice to see you. Okay. We'll see you that day.
Nadea's eye surgery is 3 weeks away.
Take care of them. All right.
Armand's open heart surgery has been underway for 4 hours. The patch has been secured, and an echocardiogram is used to check the blood flow in and out of Armand's heart.
What do you see, guy? Function looks good without any residual VSD leak. No,
Armand's heart is functioning well. Once his surgeons wire his sternum and suture his chest, the operation will be complete.
Chest closed. All right, nice and dry. Thank you. Tasha, thanks. Hey, how are you?
Hi. Good, how are you?
All right, so we're all finished. Things went well? Yes, they really did. They did.
Thank you
we
very
didn't have any specific problems. He came off bypass easily. His heart's working well. When we look with the echocardiogram at the end, we can't see any residual blockages or holes. All right?
Good.
Good. All right, now see you.
So you'll be checking on him tomorrow, or
Of
how
course.
does that? Yeah. Good. All right. Well, thanks for all your work.
Okay.
I appreciate it.
All right, so long.
Cheers.
Bye.
Armand has been transferred from the operating room to the critical care unit. He is too weak to breathe on his own and must be kept on life support.
How's his heart rate?
It goes up a little higher, but it's coming down.
Right.
ECG, so of course, there should be a hand.
The next 24 hours, as Armand's body adjusts to the new way his heart functions, could be very difficult for Armand's parents. It's the morning of Nadea's eye repair. For many children, being put to sleep is the most frightening part of surgery. Nadea's family accompanies her to meet her anesthetist.
How come you're in these PJs?
I don't know.
You don't know. So you just came here and your mum said put on the PJs and here you are. Yeah. So how come you're in the PJs? Because Dr. Kraft tells me you're getting your eye mended. Would that be correct? Okay. And has anybody told you what's going to happen to you while you get your eye mended? No. Nope. So you don't know about how you're going to go off to sleep or things like that?
Yeah, you put on your nose and your mouth, and then you count to a number, and then you fall asleep.
And it's magical kind of a sleep. So even if we shouted in your ear, Nadea, Nadea, loud, 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 wake up, wake up, wake up, you won't wake up till it's all done. And then you will wake up.
And when you go to the wake-up room, which is just through that door, you can have a freezy if you would like.
Okay.
And your mummy will wait for you here, and your brother, even if he is a pain. And we'll see you in the recovery room.
It's time for Nadea to go to the operating room.
Actually, where's your brother? Yeah, you need to look after your mum. She's going to need you in next to tomorrow. Okay? Come in. Kisses.
That's the way. Very saturated.
We'll see you soon.
There we go. Now walk really
Okay,
close
we'll
behind
see
you.
you soon. Yeah, yeah.
There we go.
You got it.
There we go.
Somebody stuck to you.
There we go.
While Nadea is anesthetized, her surgeon prepares for the operation.
The biggest concern is, are you going to get the child's eye straight? Because the surgery is meant to put their eyes in a position that once they heal up, they'll be, you know, in a position where the eyes will remain straight and hopefully straight for the rest of their life. Put this on here. That's great, thanks very much. Are you okay with that height there? So, I'm going to start with the right eye.
The first step for Nadea's surgeon is to expose the muscle that is causing her eye to drift outward.
I'm just going to make an incision to the base level, which is the sclera, that's the white of her eye. You can see that now by removing the hook, we have a muscle that's totally free, and it's going to be allowed to hang back to a position several millimeters back from where it was. Back in.
The muscle is now stitched to secure it in its new position.
And there we are. So her eye muscle has now been moved back and her surface layer is now covered over. And we have a nice relaxed muscle there. And you can actually see the eye has moved towards a little more inward position. It won't stay there very long, but it's just from stretching it out, we've actually got that eye a little in, and the same thing is going to happen symmetrically on the other side.
One day after open heart surgery, Armand's breathing tube will be removed. Removing the breathing tube could cause Armand's airway to collapse. His respiratory therapist must be ready to reinsert the tube if Armand does not begin to breathe on his own. The tube is out.
He's breathing on his own now, right?
Looks very good. Breath sounds are clear. His upper airway may be a little slightly swollen from the tube, so we give him a little bit of oxygen and some cool mist just to keep down the swelling. So he should be okay.
Okay. Great. Thanks, guys.
So far, Armand is breathing well. He will use the oxygen hood for the rest of the day until the swelling in his airway subsides. Nadea's eye muscle repair has been underway for 1 hour. Her surgeon has now moved the muscles in both her eyes to try to straighten them.
So the last thing I do is just to pull the eye over the other way to sort of make the muscle fall back. And you can see now, at least under anesthetic, that we've achieved a fairly straight, if not a little bit of a cross position of the two eyeballs. I also put in a drop of anesthetic in each eye, if we can get the tetracaine. That way she wakes up without a lot of irritation at the immediate post-operative situation. Okay, very good. Okay. Got your own room. Hi, how are you doing? How are you doing? So how are you keeping?
Fine, so how
Yeah,
you go?
perfect. 100%. Yep, no problems whatsoever. Her eyes will be fairly red, as I mentioned to you, over the white triangle on each side will be fairly red and bloodshot for about 4 weeks, and then it'll start to fade after the next 2 or 3 weeks after that. Her eyes will be a little watery. She'll be sensitive to wind and cold and bright lights.
So there's no skiing?
That's right, for probably about 3 or 4 weeks. The only concern right now is infections. If she had an infection, you would see a change in the sort of tearing to a very thick pussy discharge.
Right.
Her eye would get red, not just over the side, but over the whole white of the eye. Will get very angry red, usually swelling around the eye. The eye may start paining her. All right, so any questions? Everything is on the sheet there. It's on the sheet there, okay? So I hope that's going to do it.
3 days, right?
Pardon?
Let's go for 3 days. For your sister. Oh, but you know, she needs family support. She's family support.
Yeah, that's right. So if she plays video games with you, just be easy on her, okay? Just for the first couple of days.
I won't beat her too bad.
All right.
Hi, I'm Melissa. I'm Nadea's nurse. How are you? Good. I'll just let
Nadea is resting in the recovery room.
Okay. Hey, baby. Hey, Coca. Mama, you too. Mama, you too, baby. Shh. It's okay, baby. Mama, you too. Shh. Okay. Okay. Let's put that on the sides, okay?
As soon as she is more alert, her mother can take her home. Nadea will return to the hospital in 3 days to ensure her eyes are healing well. It's been 5 days since Armand's open heart surgery. He is well enough that the tube draining excess fluid from his chest can be removed.
Hi. Hello there. Time to take that tube out. It's time to take the tube out. You are both welcome to stay while we do this. He will cry. It's a little bit painful.
Yes.
So if you want to take a walk to the elevator, you're welcome to do that. If you want to stay, that's okay.
No, we'll stay.
Okay. So the Band-Aid stays on for 24 hours. So the one that we put on today, you
After
can
you
take
tie
off
the stitch
tomorrow.
up and
That's
put it
right.
on?
That's right. Then you can take the Band-Aid off tomorrow.
The stitch will just fall out on its own.
The stitch actually doesn't fall out on its own. We'll take it out at the clinic visit next week when you come back and see us. But it's an easy thing to take out. It's not that painful. Feels just like a little
sure.
chicken pick on your skin.
Sure.
You're still skinny. You haven't fattened up
Yeah.
yet? Not yet? I'll take you home to fatten you up, I guess, eh? Oh, you're looking
All this
concerned.
preparation, all this
on your
preparation.
forehead.
Right.
The look of concern.
Yeah. Now we
He had a
save
painkiller
over
this
there.
morning, so maybe you won't feel it so much.
We hope not. So somebody's gonna have to guard his hands for us. So Dad, if you stand there, you could just.
You know who my hands? Mm-hmm.
This incision looks really good.
You'll feel better tomorrow when you don't have this tube inside you anymore.
Okay. Band-Aids. Okay. All right. No.
It's okay, baby.
I know you kind of got to die for it, don't you? I'm sorry.
Good boy. It's coming out. It's coming out.
There you go. Good boy. Okay. Well done. Okay. That really hurt.
Now that Armand is tube-free, he is one step closer to discharge. But first, a final X-ray is needed to ensure no additional fluid collects in his chest.
They don't like it,
Yeah, I know.
Post-surgical fluids are common in cardiac patients and can reduce the ability of the heart and lungs to function.
Okay, I'm done.
3 days after Nadea's surgery, she returns for a checkup.
You see the big E up there, sweetie? Look right up there.
Her ophthalmologist assesses the alignment of her eyes.
Now what we can see here on the alignment is that she's a little bit cross-eyed, which is exactly what we wanted to achieve, because for the long-term result, that eye should start to pull back around the amount of degrees that she is crossed right now. Now up close, she's even straighter. She has maybe 1 or 2 units of crossing, and that's the reason that up close things are a little better. So the near is the first part to come into synchronized vision. The distance is the last, and I'm very optimistic for her. I don't want her running around in the playgrounds or recess gym and that sort of thing, just in those first 3 weeks. And that way she won't have any risk of bumping or having the eye hit.
But then after the 3rd, she won't be able to go skiing or anything like that?
Yeah, I'd probably give that another week.
Okay.
She should probably do the bunny slopes first, just to make sure that her coordination is right. See, her base vision should be better now, once the eyes are straight, because she'll have both eyes synchronized, looking at the same thing, and the 3D aspect of her vision should help her be better at what she does.
Nadea is healing well, but will have to wait another 2 months to see the final result of her eye surgery. It's been 6 weeks since Erin's feet were reconstructed. Before he sees his orthopedic surgeon for a checkup, his casts will be removed.
You ready, Erin?
Yes.
All right, here we go. Stay there. Lots of noise.
You know sign language?
Yeah.
What does this mean?
little bit.
Okay, let's see how well we did, Erin.
Okay, here. Just gonna crack you
Put your
open
leg
like a
flat.
pop bottle.
That's it.
Does that hurt?
Yeah.
Yeah.
Smell me now, boy.
No, I'm not smelling you now, buddy.
Don't be shy. Come on over.
Get over here.
Yuck. Want to put your nose down there and take a whiff?
Sure. Disgusting.
Yeah, well.
Ah! Woo! That was the cast.
There you go. And there's another one going in the garbage. Not keeping those there. Oh, that foot looks good, Erin.
It looks like crap.
That's a little different.
Hey.
That one looks
Oh.
good. Big difference. Big promise not to touch, Erin.
Don't touch me for 2
Okay,
to
but
3
look
weeks.
at that one. That one looks so good. We're not touching. Promise, not touching.
You're making my foot nervous.
So we'll have to
You will
ask
take
about this.
unnecessary risks.
Armand's parents stand by as his chest x-rays are reviewed.
Hi there. Oh, he's eating, having lunch. Okay. So, I have some test results for you. So things are looking good. Everybody's happy. The chest x-ray looked okay from the chest tube coming out. There were no holes. There was no fluid anywhere that shouldn't be. So, so he looks good and he sounded well. So we're happy for you to go home this afternoon. Okay. Okay. You're very welcome. Take care. Good luck. Okay. Bye-bye.
Armand has had an excellent recovery from major surgery.
You're gonna go home.
That's all right, little boy.
After just 5 days, he's ready to go home. Armand will return to hospital in 3 weeks for an echocardiogram. Only then will his parents know whether the surgery has been successful and improved the function of his heart. Now that his casts are off, Erin sees his orthopedic surgeon to assess his recovery.
How does it feel? Funny or funny?
Funny.
Yeah. I thought it would feel funny. How was the walking going in the cast?
Good.
Was it?
Yes.
Yeah, not too sore?
No.
Have a look. You haven't tried to walk without the cast yet.
No. Just kind of weight bear to get into the chair,
Right.
really. But
Are you afraid if I touch it, is it a little sensitive or are you?
Yes, it's a little sensitive.
Little sensitive.
they sure do look different.
Well, that was the aim, wasn't it?
Yeah.
Well, I think we're at the stage then of trying what walking feels like. So it's been 6 weeks.
Yeah.
So it's not completely healed yet because when I press hard, it's still sore.
Right.
But it hopefully is healed enough that he doesn't need to go back into the cast.
Okay.
And what will determine that? His walking?
We'll go out in the hallway here and let's give it a shot.
Walking after casts are removed can be hard for anyone. Erin's about to walk on brand new feet for the first time.
You want me to help you?
How does it feel?
Weak.
Weak, yeah.
That's common. Does it hurt?
No.
Sure looks like it would.
Well, he's walking gingerly, but if it was really, really sore, he can't do any damage. It's just a matter of whether he can manage.
Okay. So the bones have healed enough to support his weight.
Come on back, Erin. Just
Erin.
look like you're trying to make the way to the exit. The reason to go back into the cast is for comfort. If it's okay in terms of comfort, then we don't go back into the cast.
Yeah. So you think you can manage without being in cast now?
Yes.
My guess is he's uncomfortable a bit, but it's not so bad. And remember, he just tried it for the first time there.
That's
He's
right.
going to get more confident and stronger, and plus he's going to have shoes on. So the fact that he was able to walk as far as he did,
Okay.
I'm not denying it's still a little bit uncomfortable,
Right.
but I think he's ready to come out of the cast. That's my assessment.
There you go, buddy. Oh.
Relief.
Oh, relief.
2 months after the surgery, Erin continues to feel steadier on his feet. And hopefully, Erin's 22nd surgery will have been his last. It's been 2 months since Nadea's eye surgery.
Welcome back.
Today, she will be examined to determine if her eyes have been successfully straightened.
So how are you doing? Let's have a look at you there. Well, you look mighty good. How are things at school? Are you able to see the blackboard all right? Good. Read? Yeah, everything's okay. So we're just going to check her position of the eyes. Right, her eyes are straight, so that's excellent. So when she's using both her eyes together, her eyes are perfectly straight. So as long as she stays like that, she's going to be excellent. And up close, her eyes are perfectly straight. She's doing really well. So her vision's back to where it was. Her, her eyes are straight. Okay. It was very nice to see you. Very nice to see you. Good to see you again. Okay, you're very welcome. Okay. So take good care of your mom.
Nadea's eye repair surgery has been a complete success. And with improved vision, she can look forward to excelling at her favorite activities.
Look at her go. Unbelievable. She's just doing great. Really proud of her.
3 months after her trip to the ER, Christen has fully recovered from her head injury. It will take a little longer to recover from her new injury, a broken arm from a fall to the ice.
I fell skating a couple weeks ago and I broke it, but it's all better now.
It's been 3 weeks since Armand was discharged from hospital. Today, he returns for the echocardiogram that will determine the success of his heart surgery.
There he is.
Armand's parents meet his cardiologist for the results.
He looks great. This surgery all went fine. He had a lovely course through the hospital and very happy with his echo results. He's got a very tiny little hole still where the VSD is. He's got what we call a residual VSD patch leak. Okay, that's very common after the operation. There can be a little bit of a leak, but it's not significant as far as the pump function of the heart goes. It's important for us to know that he's got a communication between the two pumping chambers. With time, it might close by itself. Even if it doesn't close, it's not a major sort of concerning thing. How's he doing developmentally? He's pretty attentive, isn't he? Looking around all the place.
He's gotten very loud and very happy.
He's, yeah.
A lot of giggling.
Giggling and
just
talking. A lot of
and
talking now.
Talking, making noises to himself for a while.
I think we need to see him again in about 6 months.
6 months?
Yep.
Wow.
So
Great.
we'll see him again with an echo at that stage and an ECG and see how he's getting on. In the meantime, you just follow up with your paediatrician, get his vaccinations. If you're concerned about things, contact us, but get back to treating him like a normal little boy, okay?
Now that Armand's heart has been repaired, he has been able to develop like a typical toddler.
Try and put him down now, so you learn to lift up your head, right? Yeah. Yeah, he's good. He's solid. He's gained a lot of weight. Right?
Armand will continue to be followed by his cardiologist, but his parents shouldn't have to worry about the hole in his heart anymore.
Nothing down yet.